everyone. Respected dignitaries, governing body members of RAV, Director RAV, Dr. Vandana Siroha Ma'am, Gurujans, I welcome you all in another intellectual session of Gyan Ganga webinar series. I, Dr. Garima Singh, on behalf of RAV, welcome you all for today's session. On the onset, we would also like to express our heartfelt gratitude and welcome our mentors who have always been there to guide, motivate, and encourage us for the sustenance of this series. Respected Vaidya Shri Devendra Trigunaji, President of GB RAV, respected Vaidya Shri Rajesh Koteja Sir, Secretary, Ministry of Ayush, respected Dr. Vandana Siroha Ma'am, Director RAV. Today's guest speaker is Dr. Raman Singh Sir, CRAV Guru in Ksharsutra, who has joined us today for the 264th episode of this knowledge voyage. Let us begin the session by seeking the blessings of Lord Dhanvantari. Namami Dhanvantarimaadidevam Surar Surarvandit Pad Padmam Lokir Jararup Bhayamrityunatram Dhataramisham Vividhoshadinam. Om Dhanvantaraye Namah.
Om Dhanvantaraye Namah.
Now, I would like to introduce today's expert, Dr. Raman Singh Sir, who is going to throw light on the topic, role of Ayurveda in the management of piles. Dr. Raman Singh Sir is a distinguished Ayurvedic surgeon and academician from Varanasi, an MS in Ayurveda and PhD from Banaras Hindu University with a specialization in Nadi Yantra, endoscopy and laparoscopy. He has been practicing as an Ayurvedic physician and Shalya Chikitsak since 1985. Over his remarkable career, he has successfully performed thousands of surgeries and mentored more than 50 surgeons as a guru under the Rashtriya Ayurveda Vidyapeeth, New Delhi, Government of India. He has currently serves as director in Surya Trauma Center, Bhadori, and president of the Nima Surgical Society in Varanasi. Now, I would like to invite Sir to proceed with the lecture.
Thank you, Dr. Garima. I am very much thankful to Adhyaksh Vaidya Devendra Trigunaji, Vaidya Koteja ji, or Nideshak Dr. Vandana Siroha ji to give me opportunity to deliver my lecture on treatment of piles with Ayurveda, the role of Ayurveda in management of piles. Next, please. Next, please. This is the previous slide was of Banaras Hindu University, and after that, the next photograph of Dr. Professor P.J. Deshpande. This is my guru, Professor P.J. Deshpande, who taught me Shalya surgery, Ksharsutra, and even the Nadi Yantra. He provided the opportunity to do PhD in Nadi Yantra. That's why I am able to practice on Nadi Yantra, endoscopy, gastroscopy, colonoscopy, and laparoscopy. So I am very much obliged and thankful to my guru, Professor P.J. Deshpande. By according, my whole lecture is surrendered to him. I offer my prayer to my guru, Professor P.J. Deshpande. Now I will start my talk. The first slide, please. Piles is a very common disease, and it is very common problem at anal region of human being. Why human being? Because this disease occurs in human beings only. It never occurs in animals. And any problem which is present at anal area, the patient usually say, I am suffering from piles. That may be simple sentinel tag, that may be syphilis, that may be fissure, that may be wart, that may be thrombosis, piles, even malignancy and constipation. Even if the patient is suffering from constipation, they say, doctor, I am suffering from piles. If there is any flatulence and dyspepsia and colitis, even then the patient complains that I am suffering from piles. And piles sometimes in locally it is known as piles, bawasir and belsir. Pile is so common and it is very much worse to the patients that the patient always complain of piles with having very various problems in the anal region. So it is our duty to first examine the patient whether he is suffering from central tract or fissure and thrombosis or piles or constipation or whatever. Without doing examination, without seeing the anus and examining the anal opening, you cannot come to a conclusion which type of disease patient is having and what should be the real treatment for him. Unless and until you examine the patient, you cannot do the best for the patient. Next, please. Usually in piles, which is known as hemorrhoid, it is a swollen vein in the anus and at the lower rectum. It's sometimes internal and sometimes external. That is usually associated with pain, discharge, irritation, and bleeding. These signs may not be present in one patient. Sometimes the patient may complain of pain only. Sometimes they complain of discharge only. Sometimes they complain of irritation. And sometimes they complain of bleeding only. And sometimes all four symptoms are associated with a single patient. Next, please. If you look on the cause of the disease, a, our heritage is to come to a conclusion to diagnose the disease according to the prevalence of dosha. That is, Vata, Pitta, Kapha is very important. Unless and until you know the theory of Vata, Pitta, Kapha, how this dosha vitiated, how they accumulate to produce the disease, and how the samprapti of the particular disease.
यहीं पे
Keeping
साइड में ना पार्क
in
करके
mind about
लिख भी
the
लो इसमें
dosage,
क्या है थोड़ा सा
you cannot diagnose the
सारी
disease
पेटियां फिर
according to our
देखो
dosha,
तोड़ने
and
पाते
you
हैं
cannot establish the what type of treatment or medicine should be given to this patient. So the theory of Bhaspit Kapha to diagnose the disease is very important. And usually this disease occur in Mandagini, Bhat Prakop Ahar Vihar. Like in today's, the food habits are so much vitiated that the patient usually they are forced to take some diet which are high in in spicy materials. They are fried diets or the roadside. Because they are very busy. They have no time to come to house to take the good meal. So taking the food from the market, it is sometimes very bad and patient so much diseases to the patient. So it may also create a mandakani, and they are due to some decision of Vata Pitta Kapha, this disease is appear. So if the patient is having very heavy work and they are happy to take the Ruksha diet, Viruddha diet, like milk with fish, and if the patient is unable to take the meal in proper way and without the digesting the previous food, if the patient is taking this meal that is known as addition, and sometimes the patient is unable to pass his stool during the real time, that also may aggravate this disease. And sometimes the patients say that he is very unable to pass these stools, and if he passes the stool there may be some problem, there may be pain while he is defecating. Next, please. Now, when come to the common problem or common causes of the disease, usually when the diet is having with low fiber, they are very spicy diet, and if the patient is taking very oily food and take the less water, and bowel habit is either is constipation or diarrhea, or may have a habit to straining in defecation. Sometimes the patient say that I have to use to sit for 40 to 45 minutes in the toilet. So this is also aggravating this type of diseases. And sometimes there is a mechanical factor which may produce the piles like in pregnancy, in obesity, in heavy lifting work, the piles may appear. And in age related also, if you can see that when the patient becomes old in all the tissues, they are weakened, and the anal support is also weakened, leading to production of the pile masses. And sometimes family history is also present in the patient. If the mother, father, and paternal, maternal in link, if somebody is suffering from the piles, that also may create piles to the coming future generation. So, and next, if patient is having chronic cough, ascites, this is also induced the hemorrhoids. Sometimes in portal hypertension, endorectal viruses, these are different from the true hemorrhoid, and they are treated differently. Next, please. Now, if you come to the clinical feature, what the patient is having complaint. Usually, the patient complains painless, bright red blood coming during the defecation. When the patient say I am passing bright red bloods and without having the pain, this is the most important point, and which is present if the patient is suffering with the piles. Sometimes the piles may protrude outside during defecation, and as according to the protrusion of the pile mass, the piles having of the four grades. In grade one, there is only complaint of bleeding, but there is no mass. And in grade two, the patient complained that while I sitting in the toilet, when pass the stool, the some pile masses come out, and when my defecation process is finished, they automatically go inside. And in third grade, the patient, if the pile must come outside, the patient has to reduce it manually. On the fourth grade, the patient having complaint of there is permanent this pile masses coming outside, they remaining outside, and having a lot of problem like when the patient sit on any cushion, and that may be spoiled with the blood. And sometimes they tell that there are a lot of mucus discharging, and sometimes the patient complain of pruritus around the anus due in the especially in the fourth grade of hemorrhage. Next, please. Now, if further look in the symptoms of the piles, the internal hemorrhage usually not visible from the eye outside. When we examine the patient in lithotomy position or knee chest position, the from outside, if the patient is having complaint of hemorrhoids, if the hemorrhoids are internal, as I told you earlier, that it may be of internal and it may be of external. So if the internal piles is there, it cannot be visible on external examination. And if you do the digital rectal examination, that time also you cannot feel with your finger, you cannot judge your finger that whether the piles mass is there or not. But sometimes the finger is stained with the blood, and there may be irritation, uneasiness. The patient tell that I am feeling uneasiness, and sometimes he complain of the prolapse of the pile mass. In external hemorrhoids, which is seen from the outside of the anus, it is usually visible under the skin. The swelling, the pain, discomfort, itching, irritation, and uneasiness if the sometimes they feel in the external hemorrhoids. Next, please. Next, please.
Am I audible, sir?
You are audible, but video is not there.
Yes, sir. Due to some technical problem, I'm sharing it with you again, sir.
switch off कर दो।
ये में तो लेबल लगा भी होना ना, तो उसमें प्लस कर देना अगर और डाली।
Yes, now slide is displayed. Can I go through? Garima, Doctor. Hello, Garima. Garima. Hello. Hello. Yes, I can see the slide now. Hello. Hello.
Sir, it is visible. You can carry on.
Yes, it is visible. Can I carry up? Should
Yeah, I think
continue?
you can carry on.
Okay. Now, just I have gone through this slide. Can you change the next slide, please? Can you go to the next slide, please? Yes, yes. Sir. Now, the very important sign which is developed in thrombosed pile mass, thrombosed hemorrhoids, and this is the diagrammatic picture where you can see the thrombosed pile mass. This blood is accumulated. Patient complain sudden during passing hard stool. They got sudden pain in the rectal area with swelling, and they come to the physician that, look, doctor, I am having too much pain in my anal area with swelling, and this appeared 1 day back or 2 days back while I was defecating, and due to the hard stool when I pressed there, and they suddenly got the pain and the swelling in the rectal area. When you examine the rectal area, you will see, next please. Next, please. This type of swelling, you see, this swelling is nothing but the collection of previous one, please. Previous one, please. Yes, please remain here. Now, this swelling indicate there is skin, and below the skin there are some clots. So, see here the clot. So, during defecation, there may be some injury of the vein. The vein ruptures and the blood accumulates under the skin. And due to the pressure, extreme pressure, the patient feels pain because this area of the anal canal is very, very sensitive and very much painful. So, patient complain of pain with a sudden appearance and come to the doctor. Then our duty, simple duty, is to just after applying some local anesthesia, just to evacuate this blood clot, the patient get tremendous relief and give you very much thank. Next, please. Next, please. Now we come to the pile mass or ursha according to our predominance of dosha. When it looks like this, the appearance of having this type, and it is dry, when it is hard, irregular, there is no history of bleeding, but there is pain. So this type of ursha is called as Bhataj ursha. Next please. Next please. Another is Kaphajas. You see, this is Gostana car. This is Gostana car. It is big, swollen. This is hard with irritation, and sometimes there may be association of discharge also. Next, please. Next, please. And in Pitta-jars, the Pitta-karak ahara is the main cause to produce the disease. Or this appearance is like the tongue of the parrot, and may be associated with some discharge, and sometimes the blood also during examination also you can see the blood coming out, and with the result of bleeding, the patient may suffer from raktalpata or anemia. Next, please. This is the picture of Pitta jars. You see, this is like Yakridvarm or Shukjiva Yukta, Jaloka Mukhakar, with having some discharge. You see the bleeding, some bleeding is also coming out, and this produce this pain because it is compressed by the sphincter, which is very sensitive part of the anal area. So it produces dah, a burning pain, and with bleeding too. Next, please. When we come to the examining part, there is findings when we examine in the lithotomy position or a knee chest position. We can see externally there are external hemorrhoids, they prolapse, there are skin tag, there is thrombosis. So these types of lesions can be seen from externally, and on digital examination we do the digital examination to exclude other disease pathology like malignancy. Sometimes in malignancy, patient complain continuous pain with bleeding and with some irregularity in bowel habit. When you put the finger inside, there is a mass around the anus. So it is very example to examine the patient before going to a particular treatment. Now the next important examination is proctoscopy to see this lesion after introducing some instruments. The first is proctoscopy. Next, please. Now, can you play this one? Please, please play the video. Can you play the video? No, you cannot play it. I can also, I can also not play it. I cannot do anything.
माइक ऑफ करिए,
हाँ?
माइक ऑफ कर दीजिए बस।
Can I show it on my laptop?
If the video cannot be played, you can share it on your mobile, sir.
From mobile?
Cannot be played, sir.
No. Can I play from my side? I can play
Okay,
my.
Yes,
screen
you
share.
may try.
Can I play my PPT?
Yes, sir. Yes, sir. So I will
So
stop
how-
sharing your PPT. You may please try.
If you stop sharing, then I will start.
Yes, sir. You may start, sir.
शेयर से नहीं होगा ना, हमको अपना वो खोलना पड़ेगा।
ट्राई करिए सर, इस बार हो जाएगा।
कहाँ से होगा? इससे नहीं होगा भैया, शेयर वाला नहीं होगा। मीटिंग डिवाइस पे बस आपको जाना पड़ेगा।
Gyan.
due to
Hello.
Hello.
Babu.
yes,
Please display my slide after video slide.
sir, can I share the slides?
Yes, start the slide.
Okay, sir.
Yes, next slide, please. Next slide. So the main madam, I am audible. Garima, I am audible. Should I start? Continue.
Yes, sir, you are audible.
You are audible.
Okay. Please display the slide. हाँ गरिमा. Hello. So regarding management of ulcer, there are various type of treatment of hemorrhoid or ulcer or piles. The first comes is the Vaisarji Chikitsa, then Char Karma, Agni Karma, Jaloka, and Sastra Karma. Usually these 5 types of treatment are given to relieve the symptom of the patient. So if we discuss with the Vaisarji Chikitsa, next slide please. Next slide please. Now the main principles of treatment of pile mass or hemorrhoid, first of all, you have to remove the cause of the disease. Nidan Parivarjanam. The patient should be advised that whatever things you are consuming and whatever your activities are hampering your digestion, your motion, your art of defecation, and the spicy things, the food material which is less fibers, and inadequate water intake, inadequate liquids, then this problem may arise. And with the result, there are mandagini. So treat the mandagini. You have to continue some Agni Dipana Aushadhi with Am Pacha. Then power regulation, that is Kocha Shuddhi. And this Char Karma is done especially on the fleshy and internal hemorrhoids, and Agni Karma when there is hard pile mass and it is recurrent pile mass, there is bleeding, there is no bleeding, then we apply the Agni Karma. And then on other this hemorrhoids are deal with the Sastra Karma. So we will come next, please. As I say earlier, that your what if the patient should take, we should advise to the patient that he should take the this food materials which are with some uh, this, this should not be very oily material, and green vegetables. There are seasonal fruits. Takra is also good for the hemorrhoids. Then proper amount of water, regular this exercises, and you should not avoid the urge of defecation. Always you should have a habit. Patients should arrive to you make a habit to go for the toilet in particular time, and with whether you are able to pass the defecation or not, but the in particular time you should go toilet. So the toilet habits regular in regular time should be maintained. Next, please. Next, please. When we come to the this food materials which are very much causative factor to produce these hemorrhoids, this usually when the spicy material food materials, fried food materials, through fried and spicy food materials, excessive this liquor, then when patient is unable to pass his stools in the regular time manner, and when we sit for a longer time on the sitting position, and when he is carrying the heavy materials, so these are the producing factors of the hemorrhoids and bile masses. Next, please. When we come to the Vesa Chikitsa, the first principle is to correct the Agni, or to improve his digestive power and relieve the constipation. For that, usually we prescribe Chitrakarivati, Hingwadi Churna, and Panchakol to enhance, improve the digestion. They also reduces the ama and restores the normal bowel function. Next, please. Next, please. Now, the second aim of our research chikitsa is to create a bowel regulation with help of Trifla churn, Hartiki churn, Aviaris, which are commonly we use. And the benefit of these medicines is soften the stool, and there is no need of excessive straining. In very less straining, you can pass the stool, and it prevents recurrence also. Next, please. Next, please. The third principles are medicine to avoid the bleeding in hemorrhoids, and usually the Nakkesa, Lodra, Mocha, Vasa, and Yashtumari preparations, they help to prevent the bleeding. Some common yoga, that is Kamarudaras, this is this having yoga, Giloy, Geru, Abra, Mukta, Shukti, Prabal, then Bolbadras with this Parad, Gandaka, Loban, Khun Kharaba, Giloy. These medicines are very much helpful to stop the bleeding, and also according to dosa, they are pitta shaman, and they help in the healing of wound also. Next, please. Next, please. The third principles, when they are used in this relieving for bleeding disorder, the very common drugs are like Kamkainvati, which is comprises of hing, haritiki, yavakshar, chitraka, जीरा, अजवाइन, मिर्च, धनिया, त्रिफला, निशोद, and damtimu. And other is the Arshoknivati, which is very common drug, which comprises of Rasanjana, Neem bees, and Mahanimba, Hoon Kharava, Kaharava, etc. And Ars Kutharas also helpful, like which is prepared with the help of Parad Gandhaka, Vatsanaha, Tankana, Manashila, and Trikatu. And they help to reduce the bile masses, they decrease the edema, increase venous tone to relieve the pain of associated sometimes with bile masses. Next, please. Next, please. Next, please. Now the external, the local treatment is Jatyadi Ghrite, which prepared with Jati Patro, Nimba, Manjistha, Tooth, and honey bee wax. Next drug, which is very important, is the Yasti Madhu Grita. This Grita is prepared with the help of Muleti Mool, Nagbala, Pipali, and Vansalocha. And third important drug is the Nirgundi Tel. Usually, this is prepared with Nirgundi, Tiltaila, Manjista, and Langli. And another treatment which is advised to the patient with having a Ushnodak Avaha, that is Shijwal, with sometimes Triphala decoction, Panchabalkala Kwat, they are added for Shijwal. These are very much helpful to reducing edema and pain of the hemorrhageal masses. Next, please. Next, please. Now the next way of treatment of the hemorrhoid is charkaran. I told you that this can be used in when the masses are big one and they are internal hemorrhoids. First, this char is applied over the hemorrhoidal mass, and after satkal, after counting the hundreds, this will change into the color like jambu. Next, please. Next, please. Now this pile mass reduces in size, and at that time we apply some amla like some takra or amla they applied over here, and this is now completed. Next, please. Next, please. This, and this is agnikar. Nowadays, we agnikar which we use usually the cautery use the sometimes unipolar cautery, the bipolar cautery, and they are very much helpful to excise these the small hemorrhoids, especially outside the anal canal. Next, please. Next, please. Regarding this, the treatment of hemorrhoids, usually the when the char is applied only when the hemorrhoids are soft, wide, prominent, and this pratisaraniya char and sometimes Ksharsutra is also applied over here. And medical conservative treatment is recent, less symptom, uncomplicated, pathya, aushadhi, and sal. They are can be treated with these measures. And Agni Karma is only done in the when the bile mass is hard, fixed. Then Agni Karma are nowadays it can be done with the help of electrical instruments like diathermy and a special cautery machine. Then on Shastra Karma, this base is not the base of pile mass is not very wide, and when there is discharge, then ligation and sometimes ligation and excision, sometimes IRC, sometimes laser, sometimes stapler. There are multiple very
Sir, your voice is lost.
and malignancy, and then it is called as Asarde. Next, please. Next, please. Thank you very much.
डॉक्टर साहब नमस्कार।
हाँ, नमस्कार नमस्कार गुरुजी, त्रिपाठी जी नमस्कार। एक मिनट,
क्या समाप्त हो गया क्या? कुछ गतिरोध रहता रहा बीच में ना।
Thank you so much, sir. Now, if anyone having any doubts, you may please ask to sir.
नमस्ते सर। सर नमस्ते।
Let me check. Due to some technical issue, I think sir has left. Let me please give me some time.
हेलो।
चलिए, जितना ज्ञान मिल जाए उतना बहुत ही है। गुरु का एक शब्द भी मिल जाए तो अमृत के समान होता है।
प्रणाम गुरुजी।
मैंने कहा एक भी शब्द मिल जाता है वो भी बहुत लाभकारी है, अमृत के समान है। जितना आपने बताया वो बहुत है। बाकी तो दुर्भाग्य रहा कि गतिरोध होता रहा, कोई खास बात नहीं है। आप तो समय समय पर आपका कार्यक्रम सुनने को मिलता रहता है।
थैंक यू सर, थैंक यू वेरी मच।
Do we have any doubts?
सर नमस्ते।
नमस्ते।
सर माय क्वेश्चन इज दैट कि कई बार ओपीडी में पेशेंट आते हैं विद हिस्ट्री ऑफ कॉन्स्टिपेशन, but there is no history of bleeding, and only patient said that कि there is something coming out, but not a pile. When जब वो उसको दबाते हैं तो अंदर हो जाता है, तो सर वो क्या हो सकता है ऐसे, एनी डायग्नोसिस?
ऐसा हमने आपको बताया ना कि ग्रेडेशन होता है। ग्रेड 1 में पेशेंट को सिम्टम तो होगा, जैसे ब्लीडिंग होगा और कोई चीज बाहर दिखेगी नहीं। ग्रेड 2 में ब्लीडिंग हो भी सकता है, नहीं भी हो सकता है, लेकिन समथिंग कमिंग आउट, बाहर आएगा। और वो जो बाहर आया है जब लैट्रिन हो जाएगा तो अपने आप वापस चला जाएगा। और कभी कभी पेशेंट को 3rd ग्रेड में हाथ से रिड्यूस करना पड़ता है। तो ये जो पाइल मास आता है जिसमें कि ब्लीडिंग तो नहीं, लेकिन बट दिस इज पाइल मास, दिस इज ऑल्सो ए पाइल मास हो सकता है, और नहीं तो पॉलिप भी हो सकता है। तो वो आपको केयरफुली देख के एग्जामिन करना होगा। अगर वो पाइल मास है तब पेशेंट को एक विशेष तरह का एक्सरसाइज, जिसको अश्विनी मुद्रा बोलते हैं, पेशेंट जब भी शौच के लिए बैठे तो उसको बोलिए कि शौच करने के पहले रोपण शशांक जात्यादि गृहित या कोई अंदर लगा करके टट्टी ग्रासा लगा तब आप बैठिए, और लैट्रिन के बाद भी उसको लगाइए। ओके। और
yes, sir.
और पेशेंट को कहना चाहिए जब तक आप लैट्रिन के लिए बैठे हुए हैं, ये माई ऑब्जर्वेशन, पेशेंट बहुत सारे पेशेंट को जो बाहर आ रहा था ठीक हो गया, वो बाहर इसलिए आता है ना कि आपका स्फिंक्टर का कंट्रोल लैक्स हो गया है, इसलिए वो बाहर आ जाता है। अगर स्फिंक्टर का कंट्रोल आप थोड़ा सा मजबूत कर लें तो वो बाहर आना बंद हो जाता है। तो अगर पेशेंट को आप बोलेंगे जब भी स्टूल के लिए बैठिए तब आप आकुंचन प्रसारण मल द्वार का करते रहिए, विच इज नोन एज अश्विनी मुद्रा। ये एक एक्सरसाइज है, ये एक योगिक क्रिया है। तो उसको करने से वहां का टोन मजबूत होते हैं, स्फिंक्टर टाइट होते हैं, और फिर वो निकलना धीरे धीरे बंद हो जाता है। मरीज को ये भी हैबिट कराना पड़ता है कि आप लैट्रिन के बहुत ज्यादा देर तक मत बैठिए। कभी कभी पेशेंट बहुत ज्यादा देर बैठता है तो वो भी ग्रेविटेशनल फोर्स से फिर अब मल द्वार से बाहर निकलने लगता है। तो एक तो अपना वो हैबिट सुधारना पड़ेगा कि ज्यादा देर तक लैट्रिन में न बैठे। एक बार लैट्रिन गया, जोर लगा, लैट्रिन होगा तो ठीक है, नहीं तो उड़ जाए, फिर दोबारा जब वेग आएगा तब उसको जाना चाहिए। तो आपको दो चीज पर ध्यान देना है, एक तो मरीज को लैट्रिन के पहले कोई मलहम लगाने को बोलिए, और उसको ये बोलिए कि जब बैठते हैं तो टट्टी के रास्ते को, मल द्वार को आकुंचन प्रसारण किया करिए या अश्विनी मुद्रा किया करिए उसको, और लैट्रिन में ज्यादा देर तक मत बैठिए। तो ये करने से वो रिड्यूस होना बंद हो जाता है, ठीक हो जाता है। बहुत से पेशेंट को हमारे ठीक हुआ है, ये माई ऑब्जर्वेशन।
थैंक यू सर।
गुड इवनिंग सर।
डॉक्टर साहब ऐसा था कि एक योगर्ड था जो हमारे त्रिगुड़ा जी बताया करते थे। आवाज आ रही है?
हाँ सर, आ रही है, आ रही है।
तो इसमें जो रसायन बटी का प्रयोग करते थे, यदि स्वेलिंग के साथ दर्द होता है तो त्रिफला गुगलू रसायन बटी का प्रयोग करते थे हम लोग। रसायन बटी शायद कुछ कंपनियां बनाती है, तो जब शोथ के साथ दर्द भी होता था तो रसायन बटी का प्रयोग करते थे। तो क्या आपने रसायन बटी का प्रयोग किया डॉक्टर साहब कभी अपने यहाँ?
नहीं, हमने रसायन बटी का नहीं उपयोग किया है सर, लेकिन बहुत से हमारे स्फुटार रस वगैरह है, या बहुत से ऐसे औषधियां हैं जो कि पाइल मास का स्वेलिंग कम करती हैं, उसके साइज को रिड्यूस करती हैं, वेनस कंजेशन कम करती हैं, जिसमें रसायन भी एक है। तो इन सब औषधियों को अगर आप देते हैं तो वो भी हेल्प करता है पाइल्स को रिड्यूस करने में, छोटा करने में, तो भी वो निकलना बंद हो जाएगा। लेकिन जो हम फैक्टर बता रहे हैं एक्सरसाइज वाला, ये तो उसको करना ही चाहिए, और ज्यादातर तक शौच के लिए नहीं बैठना, ये बहुत जरूरी है, नहीं तो औषधि भी बाद में फेल हो जाएगी, फिर वो होने लगता है।
हम लोग जलन जब होती है दर्द जलन तो जात्यात तेल का प्रयोग कर देते। जात्यात तेल भी अच्छा काम करता है जलन में, जब ये जलन होती है।
बढ़िया। अब इसमें तो है कि सारे गुरुओं का अपना अपना भी उसमें ऑब्जर्वेशन और एक्सपीरियंस है। बहुत से औषधियां आपकी सिद्ध औषधि है, कुछ और लोग की भी सिद्ध औषधि है जो बहुत बढ़िया काम करती है। इसीलिए ये सब आयोजन इसलिए होता है कि एक दूसरे के एक्सपीरियंस शेयर करें। थैंक यू वेरी मच सर। हम रसायन को भी इस्तेमाल करके देखेंगे,
क्योंकि शोथ होती है उसमें। ये बहुत बहुत राष्ट्रीय विद्यापीठ का आपका बहुत बहुत धन्यवाद। आपका सुंदर व्याख्यान सुनने को मिला।
थैंक यू सर, थैंक यू वेरी मच। ठीक है
How can we loosen the sphincter? Can I ask that? Can I ask a question?
Yes, you can ask.
Sir, usually when patients present with constipation, they say the sphincters are so tight. And it has happened like 1 or 2 cases, we are not able to do the rectal examination because the sphincters are so tight and just burning and painful. In such conditions, what can we do to prevent the tightening of sphincters and all?
ऐसा है कि जिस पेशेंट को हार्ड स्टूल होने से एक्सटर्नल स्फिंक्टर या इंटरनल स्फिंक्टर पर डैमेज हो जाता है, उसको हम लोग बोलते हैं परिकर्तिका, और उसको फिशर इनोनो बोलते हैं। तो जब फिशर इनोनो हो जाएगा, वहाँ पर वुंड हो जाएगा, तो वो स्फिंक्टर बहुत टाइट हो जाएगा। तब पेशेंट को लिटा के, एक तो पेशेंट को हिस्ट्री से आप समझिए कि उसको एनल फिशर है। दूसरा, जब आप पेशेंट को लिटा के लिथोट्रोपी पोजीशन में या किसी पोजीशन में, लैटरल पोजीशन में, नीचे पोजीशन में जब आपको एग्जामिन करना चाहेंगी, तो सबसे पहले एग्जामिन करने के पहले हम लोग बटक को रिट्रैक्ट करते हैं। तो जैसे ही आप बटक को रिट्रैक्ट करेंगी तो पेशेंट को पेन फील होगा। इसका मतलब है कि उस स्फिंक्टर में बहुत स्पाज्म है, क्योंकि थोड़ा भी रिट्रैक्ट करने पर पेन फील होता है। तो यहाँ पर कभी भी फिंगरिंग नहीं करना चाहिए। अगर कोई लड़का करता है तो उसको एग्जाम में फेल कर दिया जाता है, because whenever there is lesion of painful lesion at the anal canal, you should not examine patient in OPD procedure. You go through the anesthesia until unless you should not examine and produce so much more pain to the patient. It is not your duty. It is not, you are not responsible for that. So just when you simply retract, there will be fissure. You can see the fissure cut area either at the 12 o'clock or 6 o'clock. Then you avoid the putting finger into the inside. This you should keep in the mind. Otherwise, the patient will run away from you. She will never come to you. Next, please.
Do we have any other questions? So much, sir. Now we are concluding the session. On behalf of the organizing committee, I would like to thank Dr. Raman Singh, sir, for delivering such an insightful lecture. I would like to extend my sincere gratitude to our mentor, Vaidya Tribhunaji, President of GB RAV, for his continuous support, guidance, and blessings. I thank our director, Dr. Vandana Siroha ma'am, who is the guiding force for all the events at RAV. I would also like to thank Vaidya Rajesh Koteja, sir, Secretary, Ministry of Ayush, for his participation and encouragement in all our endeavors. Most importantly, I would like to express our heartfelt thanks to all the gurus, shishyas, and other scholars for their presence and active participation for making this webinar a successful one. Thank you all.
Thank you, Garima.
Thank you, sir.